Hi, I'm Dr. Meenakshi Ahuja. I'm Senior Consultant, Obs and Gynae at Apollo Cradle Royal. And we're going to tackle a different topic today. It is the uncomfortable questions in pregnancy. 10 questions which you always wanted to know about, but you were embarrassed or found it difficult to ask your gynecologist. So, the first question is that should I eat for two, and how does my weight gain happen in pregnancy, and am I gaining too much weight? So in pregnancy, the first thing you need to understand is that you do not have to eat for two. In fact, the first 3 months the baby is not even dependent on you for the diet. There is a yolk sac inside from where the baby gets nutrition. After 3 months also, the baby requires only about 300 to 350 calories more, and hence you need to actually just eat better, healthier, probably smaller frequent meals, but your calorie requirements are taken care of in an extra glass of milk. The weight gain in pregnancy could be anything between 10 and 15 kgs. So roughly, if you're looking at it, if you're an average weight, you can look at a weight gain of 1 to 2 kg in pregnancy, and that should be just perfect. The second question is that I feel really gassy in pregnancy. It could be even embarrassing. So what do I need to do? So feeling gassy in pregnancy is perfectly normal. You tend to burp. The pregnancy is growing, it's pushing the intestines. There is a hormonal change which is happening in pregnancy. And of course, we add to it by telling you to take a healthier diet, which is richer in legumes, pulses, salads, fruits, vegetables, and protein, which are all gasogenic. So it's perfectly fine if you are feeling gassy in pregnancy. Probably just eating small frequent meals would make the gassiness little less, and you would feel comfortable if you can put it about 20 minutes walk after every meal, and especially after your dinner, especially after checking with your gynecologist that there is no contraindication to that. A lot of women feel a lot of discharge in pregnancy, so they get worried whether it is normal or not. So in pregnancy, again, because of the hormonal changes and the increased blood flow to your vagina, it is possible that your discharge increases. However, this discharge should be clear. It could be, and it should be non-itchy and non-smelly. So if it's irritating or itchy, smelly, or burning, then you must consult your gynecologist. Otherwise, increased discharge during pregnancy is absolutely normal. Next, is it safe to have sex during pregnancy? If there's no contraindication like a low-lying placenta, sex is absolutely fine. Normally, I would recommend to my patients to avoid sex till we get the first ultrasound scan done, just so that we are sure that everything's in place and there's no problem. After that, it should be perfectly fine. At 12 weeks, if the placenta is not low-lying, please go ahead and have a normal sex life. And probably till about 32 to 34 weeks, it's absolutely safe. Some people do tend to have sex after that also. The only problem is that it can cause premature contractions. However, once the water breaks or something, it's not a great idea. So at least at that time, you must avoid intercourse. Many women experience a change in their sex drive, and that may worry them during pregnancy. Also, the husband may have a fear of having sex in pregnancy. So yeah, I would like to talk about that. So it is perfectly normal because of the hormonal changes that occur, that a woman may feel increased sex drive because of the blood flows to the vagina and the uterus. Many females also feel an aversion to sex. So this is normal and you don't need to worry about it. I guess your partner has to compromise, but you must understand that sex, unless there's a contraindication, is absolutely fine, and whatever comfortable position you are in, you can go ahead and have sex. Similarly, if the husband has a fear of having sex and you feel like there's really no problem, he probably just needs a little reassurance, and a change in the position should make you feel both comfortable and enjoy the rest of the pregnancy. Yeah, so this is interesting. There are a lot of women who ask me about the beauty treatments in pregnancy. Is it safe to bleach? Is it safe to get your waxing done and all? So usually there is no problem having most of your beauty treatments. There are certain things that you need to be a little careful about. I would suggest that if you need a hair color, it's safer to get an ammonia-free color done. Bleaching and waxing for the rest of the body is perfectly fine. Talking about bikini wax, just so that there's no pull on that area, I would suggest to avoid it. However, definitely pregnancy is not the right time to try it for the first time. Massages are fine, but not on your lower back, not on the belly obviously, and I would definitely not recommend any massage on the foot area. Just that is a pressure massage, so that we don't have any problems of causing any premature contractions. But otherwise, spa therapy is absolutely fine. So the next apprehension that women have is that, will I have an abnormal bowel movement during delivery? The first thing for you to understand is that it's not embarrassing, it's perfectly fine with your doctor. However, there are certain things that we take care of so that you don't have any embarrassment during that time. That is that I would probably give an enema before you start labor or in early labor so that your bowels are clean, and we are usually keeping you on liquids during labor. However, if there is any expulsion of stool or some urine while you are pushing out the baby, it's perfectly fine and you don't need to get worried about that. Another apprehension that women have is that after normal delivery, will my vagina really get stretched out and become loose after delivery? Also, that is sex going to be painful after delivery? So coming to the answer, so the vagina is a very flexible organ. It can distend to deliver the baby and after that come back to its normal size and shape. However, it is a great idea to do the Kegels exercises, which your physiotherapist will guide you to after delivery, so that your vagina comes back to normal shape and the uterus doesn't sag. Sex after delivery, because of the stitches being painful, not really. So it does get normal. However, you can use a lubricant jelly after 40 days of delivery when sex is perfectly normal. Many women are apprehensive about the bladder control and the bowel control after delivery because of pushing out the baby. The bladder and bowel control may be a little loose for the first 40 days, but doing the Kegels exercises will again get it back to normal and there should be no problem. In 40 days, with good exercising, your bladder control and the bowel control should be back to normal. Yes, this is interesting. So last but not the least, there are many women who are worried that will they sleep through labor and just miss it. It's really not practically possible. Labor pains are good enough to keep you awake, and definitely I tell a patient that if you're not sure whether it's labor and you can sleep through it, it's not labor. It's probably false pains, and which will get okay on their own. There's no way you can miss labor. Once you start getting the contractions, they will not let you sleep and you will need to come to the hospital. If your water bag breaks too, there will be a big gush of water, like you've just peed in your bed or otherwise, so you can't miss it in your sleep also, and you will realize. So don't get worried, you're not going to miss your labor. Thank you, and with the Polo Cradle Royale, you're always in safe hands.